Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield, so this is a short video on testing. Many of you have been emailing me, I'm sure you've been emailing lots of other people, why can't I get a test? So I'll explain what's going on, why it's going on, and how we're going to address this. So there's a lot of capacity nationally for testing. The demand for testing has gone up far faster than the capacity that's available, and there are lots of things that are contributing to that. People returning from holiday wanting to get a test to avoid a quarantine period, children going back to school who develop illnesses. That always happens when children go back to school, and we're asking people to get tested, and that has also put pressure on the testing system. People returning from holidays to go to work, and sometimes employers have required them to have a negative test before they come back into work. Again, that's another thing that puts pressure on the testing system. So you should get a test if you develop symptoms that suggest you might have coronavirus. Those are three symptoms: a high temperature, a new continuous cough, and or a loss or change to your sense of smell or taste. Most people with COVID-19 have at least one of those symptoms. Differentiating COVID-19 with the common cold is a commonly occurring issue. The BBC put some really helpful advice on their website on how to differentiate common cold and coronavirus late last week. It's very helpful. I'd encourage you all to look at that, and the link will appear at the end of this video. Whilst most people are getting tested when they display symptoms, there's a significant evidence that lots of people who don't have symptoms in Sheffield and elsewhere are coming forward for a test. A recent survey at testing sites found about a quarter of people who didn't have symptoms were asking for a test. We're really clear, we've always been clear in Sheffield, if you don't have symptoms like coronavirus, don't ask for a test. And that will remain the case for the foreseeable future. We may change that policy, but for now, only seek a test if you've got symptoms. There's very high demand, and the high demand is limiting the availability of people who do have symptoms to actually get a test to rule in or rule out COVID-19. So here in Sheffield, the local COVID-19 testing centres at Sharrow and Darnall aren't now accepting walk-ins. They were set up to be walk-in centres. We've changed the way they operate, and they're no longer accepting walk-ins. You must book before turning up by calling 119 or go on online nhs.uk/coronavirus. It may take longer to get a booked slot because the test centres are very busy. That's a challenge, no doubt about that. No doubt about the fact that that's a challenge. It's not about a shortage of swabs. It's about a shortage of lab capacity, and the way in which the Department of Health are managing that lab capacity is that when the available lab capacity is exceeded, they will close the slots, and that means you can't get an appointment to go and get a swab taken. Fully accept that is difficult, and is causing lots of frustration for lots of people. I suppose we all need to play our part to protect the capacity of the service for those who do have symptoms. So as I say, if you don't have symptoms, don't ask for a test. Clarifying self-isolation is quite important. So if you have coronavirus symptoms, you must isolate immediately for 10 days and don't wait for the test result before starting to do so. If you're identified as a contact of a positive case, then you must also isolate for 14 days, even if for some reason you get a negative test during that period. From 28th of September, people in England who refused an order of self-isolation could be fined up to a maximum of £10,000. And a new legal duty requires people to self-isolate if they test positive for coronavirus or are contact traced as a close contact of a case. Fines start from £1,000 to £1,000 and rise up to £10,000 for repeat offenders. And new measures will also include penalties for employers who punish those who've been told to self-isolate. A £500 payment will also be available to help low-income workers to self-isolate, and again, the administrative arrangements for that are being worked out this week. So don't get tested if you've returned from holiday abroad or are about to travel. Don't use the testing service to get a test in order to travel to another country. We don't provide certificates for travel purposes. don't get tested if you don't have symptoms, but your employer has asked for evidence of a negative coronavirus test before you come back to work. We're aware there is some employers are asking for that, and it's certainly something that we're not recommending is necessary. Don't get tested if you've been in contact with a confirmed case and or another member of your household has symptoms if you don't have symptoms. Only get tested if you have symptoms. You may be advised to isolate if you've been in contact with a confirmed case, but only get a test if you develop symptoms yourself. So by following those fairly simple rules, we'll maximise the available testing capacity that we've got within Sheffield and ensure that those who do have symptoms can get tested. We're actively discouraging people who don't have symptoms to get tested. So if you have symptoms, you can book a test by dialing 119. Don't call 111 because it cannot help you with tests. Clearly, if you have other medical issues, then you could and should call 111, but don't call 111 to get a test. Schools and higher education settings, we're aware that some schools are encouraging students to get a coronavirus test if they don't have symptoms. For example, if a student in their bubble has had a positive test, that's not something that we're encouraging. In fact, we're actively discouraging that. Lab capacity has reached its capacity, and it's important that we focus our capacity on those people who've got symptoms, and that helps maximise the available capacity that we've got. So I completely understand the frustrations that are faced by schools, parents and carers over the delay in getting a test. And I urge schools, students and parents and carers to ease this situation by not booking a test if you don't have symptoms. Lastly, businesses and employers. I'm aware that some businesses are requiring employees to have a negative test before they come back to work, regardless of symptoms. Again, something I'm actively discouraging. It's not necessary, and it does use the available capacity. There's a range of reasons why we are actively discouraging asymptomatic testing, but the two main ones are because capacity is limited, and with the available capacity, we should absolutely encourage testing in those who do have symptoms, because that's by far and away the most important group that need to be tested. And secondly, the hit rate the yield for a positive test in a relatively low probability population doesn't make the testing worthwhile to be testing without symptoms.